Well, I'm Dr. Jim Del Rosso, a dermatologist based here in Las Vegas, Nevada. And number one, want to celebrate the great performance so far, uh, winning really well in the men's Olympic hockey team. But I'm really here to talk about what we're going to be presenting at the Winter Clinical Miami meeting that comes up later this month in February. And on my birthday here today, my first presentation at 72 years of age and still going strong, though I can't play hockey, I can't stand on skates, is my presentations at this meeting. And one of them is with Dr. Andrea Marina and Dr. Steve Dave Louie, both who are fantastic educators, bringing the group up to date on hidradenitis suppurativa. So there are so many advances that we have, greater understanding of the disease, but we know how difficult it is for patients that have these tender inflamed abscesses and nodules in their many areas of their body, but concentrating in intertriginous areas like the axilla, under the breasts, on the breasts, the groin, but can be in many locations and painful, often drain, often malodorous, and interfere with so many aspects of people's lives. So we do have a lot of conventional therapies that we've used for years, but not really able to block the progression because this is subcutaneous and also to some degree has systemic stimuli. A lot of times related to the inflammation from being overweight will contribute to the inflammation of the disease. So we now have a more holistic view, I might say, of the patient. So really to find out what the patient's been through, how it's affecting their life, what's bothering them right now, to get them out of pain and reduce their current lesions and prevent the progression with new lesions forming. And that's going to happen from a systemic treatment, not from a topical treatment. And we do have biologic agents that are now approved. We have one anti-TNF agent, adalimumab, and we have two anti-IL-17 agents, secukinumab and bimekizumab, and there are more treatments coming to try to stop the progression of the disease so they don't get these inflamed areas that can then lead to scars and sinus tracts that are persistent, that will then require some physical intervention, potentially even excising or deroofing lesions. So it is a medical and a surgical, but also a pay attention to what's happening above the neck in the people's minds because it's really a very difficult disease. We touch a lot on the comorbidities that patients might have and how to manage them in a fashion that we're not bombarding the patient with too much up front and addressing where they're at. A lot of them have disappeared for years because they tried treatments that didn't work and they're coming back, but they might be hesitant about whether or not we can really help them. So there has to be a lot of sit down, face to face, eye to eye contact about what's going on. You don't have all day with every visit, but you need to focus with them on them knowing that you understand the disease, that you care. You're trying to focus on what needs to be controlled now and progressively move into what's going to be best for that patient, along with the patient explaining to you and deciding with you what's going to be best. But there are risk factors, smoking, uh, being heavier in terms of your body weight, are all things that, if these things can be modified, can also help in slowing the progression of the disease. So I think that's an excellent discussion. And Dr. Dave Louie does a lot with the actual procedural aspects, and he's going to be showing a lot of that. So my two colleagues with this presentation are great to work with. At the Winter Clinical Hawaii, we had a similar presentation, Andrea Marina and Jenny Shao on this that went very well. Now we have Dr. Steve Dave Louie as along with Andrea and myself, and he's fantastic and Jenny also. So if you can go back and look at that prior video from the previous meeting, I think you'll really be up on hidradenitis suppurativa. And then I have a presentation along with who I think was the rookie of the year, the newcomer of the year in 2025 in dermatology. Just a fantastic guy, a great educator, and is very practical. I always enjoy listening to Dr. Ruiz de Silva from Virginia Beach, and we're going to be talking together about some cases and challenges that come up in dermatology, primarily with what we talk about as being more complex inflammatory chronic skin disease management cases. And one of them is if you see a young woman, let's say 28, 30 years old, having difficulty with atopic dermatitis, maybe not responding optimally or having problems with injectable biologics, and looking at risk factors when you may be prescribing a Janus kinase inhibitor, the two that are approved, the upadacitinib and abrocitinib, and looking at if they're on oral contraceptives, that has its own risk of venous thromboembolism, which has been associated with Janus kinase inhibitors. Relatively uncommon in this particular population of patients, but can occur. But also smoking as a separate risk factor. So let's say you have a young female patient who's a smoker and on oral contraceptives. Do both of those independent risk factors compound to increase that risk of thromboembolism? Uh, the data that we've been able to find on abrocitinib, which is complete from many of the clinical studies, showed that I believe it was 78 cases uh, of women that were in the trials that had moderate to severe atopic dermatitis were smokers, mostly current smokers, but could have been former smokers, and currently on oral contraceptives. None of them in the studies developed venous thromboembolism, which was very encouraging. Doesn't mean it's not possible. The majority of the patients that did, unfortunately, there were not very many, but the ones that did, including those females, were overweight. They were immobile. They didn't have a lot of mobility, and they had risk factors, previous thrombotic episodes. So those were the major risk factors, but it's still always a possibility. We were not able to get all the data on upadacitinib, but my understanding from seeing that discussed by Dr. Bunick at another meeting is that that risk appears to be no greater in that particular group, but I don't have the full data on that. But it's good news. We also go over some other areas, this personalized atopic dermatitis test from Castle that allows us to figure out if patients are going to be very high Th2 inflammation and would be highly responsive, very responsive to dupilumab is what's been looked at primarily, but looking at even the anti-IL-13 agents, that they would be more likely to respond or respond very well. Janus kinase inhibitors would work, but not necessarily any better than the biologics if it's driven primarily by the Th2 inflammation, IL-4, IL-13, and even IL-31 is part of that package. But there's another subset of patients, about 1 out of 4, that do not have as high a Th2 inflammation component to their disease. They still have it, but they have, Th1, they may have a lot more IL-17 or IL-22 contribution, or in the even lesser responders in the study that was looked at with dupilumab, interferon gamma. The Janus kinase inhibitors work very well in that particular group of patients. And even if the biologics are going to work, the Janus kinase inhibitors in that particular group of patients have far superior results and work 4 times faster. So this test would allow you to characterize upfront which group and help you select treatment with accuracy, or if there's a problem with a specific therapy, um, you can then try to figure out what would be the best direction to go without just pulling another drug off the shelf and not having any direction in your treatment. There's also a discussion on patients that have had chronic pruritus of unknown origin. Dr. De Silva has a very interesting case there where he had to work at combining a variety of different therapies for the management of that very difficult situation. There are other cases, but in the interest of time, um, we certainly hope you get an opportunity to see this presentation. It's always exciting every year to present at these major meetings. Thank you very much.